Hi, everybody. So the big question is this. Are the foods we're eating making us sick? It's a big question. It's a loaded question. A question that many people ask themselves for a long time but never get a clear answer. My name is Dr. Maribel Perez, Clinic Director at Body Sculpting. For the past 20 years, I have been helping sick people get well from a functional standpoint. We dig, find, and fix the root cause, not just cover up symptoms with medications. That's the medical model, where you have XYZ symptom and the doctor gives you XYZ medication to cover up that symptom, ignoring the underlying root cause. We can do better. We can live better. And that is why we are unique. We're different. We get such great results. In this video, I want to break down a 3-pillar approach that we use with clients. Foods, nutrients, toxins. Let's talk about foods first. For example, this client's test results show dairy off the charts. They should not be consuming dairy. Eggs are off the charts. Grains and gluten are off the charts. Avocado, bananas, raspberries, green peppers, and a few other foods are also off the charts. Foods that are normally considered healthy are not healthy for this client. We are all unique. We are all different. We all respond and react to foods differently. This is why it is so important to not guess what is causing the symptoms. At Body Sculpting, we don't guess. We food test. We dig, find, and fix. That is when transformation happens. There are 3 main reasons why we food test patients. Number 1 is inflammation. We know that sensitivities and intolerances spike inflammation in the body. Number 2 is that it gives the digestive system a break. And number 3 is that it gives the immune system a break. Quick tangent. There are 50 million Americans with some sort of variety of autoimmune conditions. 50 million. That is 1 in every 6 people. 1 in every 6. So we're talking about thyroid, Hashimoto's, MS, lupus, rheumatoid arthritis, celiac disease, Crohn's disease. There are over 140 labels of autoimmune disease. I believe it's because of inflammation that causes by these food sensitivities. When we test, we are ultimately testing the immune system. Our immune system sees these food sensitivities as foreign invaders. Your immune system is giving you signals. When you continue to consume foods that your immune system considers foreign invaders over and over again, eventually your immune system turns on itself. So that's pillar number 1. Modify and customize foods accordingly. Pillar number 2 is deficiencies. Where are you depleted? Where are you deficient? Where are there shortages? Is it vitamin D, B12, vitamin C, B complex? How do you know which supplements to take? Are you guessing? We need to test. That is why we are unique and different. We don't guess, we test. We may place you on supplements to bring your levels to a more optimal level. The lab will give us a list of foods that are abundant in that specific nutrient as well. So let's say you're deficient in glutathione. I would say, hey Mary, go eat more broccoli or cauliflower. So we'll give you a whole list of foods that are abundant in that specific nutrient. Does that make sense? Pillar number 3 is toxicities. We look at heavy metal toxins. The standard American diet is very processed. It is pro-inflammatory. It is very toxic. Too much sugar or too many things that turn into sugar. By toxins, I mean high fructose corn syrup, preservatives, MSG, trans fats, colors, dyes, aspartame. These things we know wreck your health. They spike inflammation and cause a downward spiral in your overall health. If you are struggling with any sort of health challenge, let me name a few. Weight loss resistance. You have tried everything. Not only can you not lose weight, but you have a hard time keeping it off long term. You are eating the wrong foods. You are eating foods that are spiking inflammation in the body. One of the most common weight loss questions I get is, Doc, what's the best weight loss program out there? Is it keto, paleo, plant-based, Whole30? The answer is one diet doesn't work for the masses. There needs to be objective testing involved. For example, a keto diet would be this person's worst nightmare because this person is sensitive to dairy, avocados, raspberries, and the keto diet is full of all these foods. This person would not do well on keto. Weight loss resistance, digestive challenges, IBS, constipation, diarrhea, gas, bloating means that you're eating the wrong foods. Chronic pain and inflammation, low back pain, neck pain, headaches, joint pain, any sort of itis, bursitis, tendinitis, arthritis, plantar fasciitis in your feet, gastritis in your stomach, acid reflux. All of this is caused by inflammation. We know that sensitivities and intolerances spike inflammation in the body. Weight loss resistance, digestive issues, chronic pain, thyroid challenges, Hashimoto's, diabetes, neuropathy, all other autoimmune conditions, lupus, MS, rheumatoid arthritis, celiac disease, Crohn's disease. We test a lot of kids with ADHD. ADHD kids have a gut-brain connection. If the gut is not working right, the brain's not working right. If you have a child that's fidgety, bouncing off the walls, easily distracted, not doing well in school, let's get them tested because it will help the brain function. That is why ADHD kids respond very well to food sensitivity testing. Anyone with thyroid challenges, Hashimoto's, all the other autoimmune conditions, lupus, MS, rheumatoid arthritis, celiac disease, Crohn's disease, when we test, we are looking at your immune system. Your immune system is saying all of these are foreign invaders. Your body is looking at these foods like they are foreign invaders, spiking inflammation and in turn, overwhelming your immune system. Does that make sense? So you get this brain fog, this chronic fatigue, anxiety, depression, walking around in a haze, forgetful, afternoon energy crashes. At 2 or 3 o'clock, you're reaching for more coffee, soda, candy, sugar, more something, anything to get you through the day. Maybe all these symptoms are caused by food sensitivities. Folks, we have 71% of people in this country that are overweight or obese simply because the standard American diet is full of sugar and the excess sugar gets turned into fat. This fat gets stored in the tummy, hips, thighs, triceps, face. This is where the body abnormally stores fat. We have got to make changes. We have to modify our lifestyle. We need to balance out the blood sugar. We have a diabetic epidemic. There are 30 million Americans that have full-blown diabetes, but there are 70 million that are pre-diabetic. If you don't get the blood sugar balanced out and make these changes now, eventually, sooner rather than later, you will get full-blown diabetes. Here's what we have to offer, folks. Beneath this video, there is a button to click on, which takes you to my scheduler. If you are struggling with any sort of health challenges, I would love to come alongside you, hop on a quick phone call, so many people can benefit from being tested. Here's the thing. You can test from your own home. That's one of the most common questions I'm asked. How do I get tested? Do I need to find a clinic nearby? No. We send you the test kit instructions, and you test yourself from the comfort of your own home. There's no doctor visit needed. You don't have to sit in a stuffy waiting room. No. You can test yourself. It's very simple, very easy. We send test kit instructions out every single day. People test themselves from their own homes. Here's what I want to do for you. Normally, a phone consultation is $150. However, because you found this website, I want to offer the first 20 callers 100% free phone consultation. No cost, no obligation. It's just time to get your questions answered and to find out if the food testing makes sense for your health concerns. A phone consultation gets that done. Quick, easy, and fast. Normally $150, but today is your lucky day. 100% free for the first 20 callers. I have 2 rules and 2 rules only. Number 1, please show up to your phone consult. If you take the time slot, essentially you're taking away time from someone else who could use that time. If we're going to carve out time out of our own schedule, please carve out that same time out of your schedule as well. Rule number 2 is be ready to take action. What I can provide is transformation, not more information. You have YouTube, Google, Dr. Google at that, to provide a lot of information. But what we provide is the transformation. We come alongside clients and give the support, recommendations, suggestions, accountability, follow-up. We tell you which foods to get rid of, for how long, and how to reintroduce those foods back into your diet. We are after the result. If you need to lose 20 pounds, 30 pounds, 50 pounds, whatever it might be, clearing up the brain fog, stopping the chronic pain, that's what we're after, the transformation. And that's what we can provide for you. That's rule number 2. Be ready to take action. Because if we say, Mary, we have to go gluten-free or dairy-free or get rid of eggs, be ready to make those changes. Because that's how we get that transformation. Lastly, once you make your appointment for your free phone consultation, the health coach will call you and connect and determine if food testing is right for you. Any questions will be handled on this call. Click the button beneath this video and we'll talk to you soon. Take care.